Well, it's good to be here. I'm glad some of you all came out or crazy enough to come out with the weather. I don't know which one's which, but I'm blessed to be here. When we thought about, well, when King's Daughters asked me to speak, they asked me to talk a little bit about the journey that I've been on. And so what I'd like to do is talk a little bit about that. Not a lot of the details, but a few, because I'm sure some of you have heard them, seen them on Facebook, but might not know the whole story. And then say a few things of what I learned, and then for most of it, we're going to talk about heart disease. Even though my story is not heart disease, but heart disease is, we're here for Heart Month, and heart disease is still the #1 killer in America. So that was a younger picture. My daughter told me I still had hair there, so. Oh, wait a minute. I thought there was supposed to be a picture. There was supposed to be, wasn't there?
There was a picture on the first slide.
How do I go back?
Just arrow back.
No, I thought there was a picture of a road. All right. My props budget wasn't as good as what I thought it was supposed to be. It was supposed to be a road and a journey, so that was supposed to be to set off me talking about this. I actually thought about this beforehand. So my journey on this started on this segment of June of last year. And I was on call, and following that, I developed a little bit of a cough and some pleuritic chest pain. And pleuritic chest pain just means you have it when you breathe deeply. So I got a chest x-ray, and it wasn't good, and I got a CAT scan on that Wednesday and went to work the next day. Pulmonologist and I were talking on Thursday afternoon. He says, this is a fairly diffuse process. It's in both of your lungs, and we probably should just admit you to the hospital. Now, I say that because I really wasn't having that much of symptoms. I mean, the morning that I went into the hospital that afternoon, I rounded and performed a heart catheterization with lead on me. So that kind of gives you the idea. I mean, looking back, probably did have some symptoms, and we'll kind of talk about that later, how symptoms kind of can masquerade themselves. But at that time, I really wasn't having that much symptoms. So I go into the hospital on Thursday, and in a couple of days by tests, scans, bronchoscopy, thoracentesis, other means of torture, they diagnosed me with metastatic lung carcinoma, adenocarcinoma. It was metastatic because it was in both lungs and went through the mediastinum. So I was transferred to Cleveland Clinic and was there for a week. Had a lot of other tests, scanned from head to toe, and they agreed here that I had metastatic adenocarcinoma of the lung. It was in both lungs. It was also in the brain and spine. Had 7 spots in the brain. And 4 in the spine. The Cleveland Clinic wanted to see if I had a mutation, because, you know, I'd never smoked, never been exposed to asbestos. I mean, more than just a regular person, but never worked in it, never been exposed to any of those things. So they wanted to do testing to see if I had a mutation. because 60% of the people that have lung cancer that don't smoke or been exposed to anything like that have a mutation. And so, but it takes about 3 weeks to get all the tests back. And so they took those tests. Now I will tell you that I ended up having a mutation, axon 19 deletion, and was started on Tagrisso, a medicine for that, when I was at King's Daughters later, but we haven't got there yet, but I'll let the cat out of the bag. But that was a low point for me. So I went home and was home for about a week. I went to my church, had them pray and lay hands on me and anoint me, according to James 5. And then I got sick. Had to come back to the hospital. And within, I don't know, 3 days, I was in the ICU. I was extremely ill. It was so quickly. My cancer was a very aggressive form. It was lymphangitic spread, which means when you think about cancer, you kind of think of somebody having a mass. But if you looked at my chest x-ray, it was just like a shotgun blast across my chest. It was diffuse. A lot of small things, but in both lungs and diffuse. And that's when I first came to the hospital. It's interesting was they were looking a lot at infection, because there in the Cleveland Clinic, they were saying, you know, if this is all cancer, you should be dead. So, so I was in the hospital doing very poor. I was hypoxic, which means I had a low oxygen. I was going into kidney failure. I was anemic, needed blood, which is common with diffuse types of cancers. I was hypotensive, tachycardic, had cardiac arrhythmias. I was doing very poor. This was at a time when they didn't think I was going to make it, and told my family that. Which, if I was rounding on myself, I would have said the same thing, looking at it from a medical standpoint. During that, I was in the ICU about 2 weeks, and I received great care at King's Daughters. Tremendous. But during that time, my pastor at Rose Hill had organized a 24-hour prayer vigil at King's Daughters, where it was just from 8 a.m. to 8 a.m. the next day, that if anyone wanted to come, they could. And King's Daughters also organized 2 prayer services for me. And Bellefonte did one too. And I had thousands of people praying for me around the world. And, you know, there was so many people that sent texts and visits, and I thank you for those. And a lot of people wanted to visit, but I was so sick, crowded, couldn't get in. I understand that. But for the ones that sent cards and gifts and food, my family thanks you for the food, but mostly prayers. And I improved. I was in the hospital for almost a month. About 2 weeks in ICU, I think 3.5 weeks to 4 weeks total. But I improved, went to the floor, and got out of the hospital August 3rd. Very weak, Taking a shower was a big deal and wore me out. I had to get a nap, and I was on a walker. So I continued that, and then I got my scans again in September. Been out of the hospital August 3rd, almost died in July. And then my scans in September were much improved. My lungs, like I said, it was a diffuse process. The worst was the left. It was all whited out with tumor. But now it was much improved. Still had tumor there, but you could see air and you could see everything through it, and it was greatly improved. The right lung was greatly improved. The spots in my brain were gone. The spot on my spine were gone except for one little one that they didn't know if it was calcium or tumor. So within that short time, that was an incredible improvement there. And I'm a testament to the power of God. And prayer. People, and my scans again in December were even better. Much improvement in all of them. I still have tumor in the left lung, but everything else is greatly improved. I still have oxygen, and people ask that. It's because my cancer was so aggressive that even though the cancer is improved, the scar tissue in my lung is still there. So that's why I still have oxygen on. Hopefully I'll be able to get rid of that, but they don't know for sure. People always ask me what I've learned from this, and you know, it's always a good question. I think when people think about death, they think about life. And that's not such of a morbid idea. You know, when you go to a funeral of someone, you don't think about the way they died, you think about the way they lived. And I think that I think I had it before, but it's much more zoned in, that to have an eternal view of your life. And that you step back and you look at it from God's perspective, because it changes everything. I think that this has strengthened me in my faith. I think that this has helped me to encourage other people. I think that this has helped me dwell on what's important, of eternal things, and hopefully it's allowed me to, what every believer should do, is give glory to God in everything they do and tell others about the gospel. Charles Spurgeon, a great preacher of old, said that some of the greatest truths of God can only be learned through affliction. And I believe he's right, because you realize your time is short and to be about important things. Because there should be no difference in our beliefs and our actions. And I'm a blessed man. Well, talked about my illness, my disease. So it's heart month, so I want to talk about heart disease. 800,000 Americans die of cardiovascular disease annually. Every 40 seconds, someone else dies of heart disease. 90 million in the U.S. live with heart disease, and almost 800,000 will have a heart attack this year. Everybody's family just about is touched in some way by heart disease. You know, I have cancer, but you know, we think about that a lot, cancer, but if you put all the deaths of cancer together, every type, heart disease kills more than all of them combined. If you add all the strokes and cancer together, that's about how many heart disease kill. So it kind of, it's one of those things we know it does, but it's not really to the point where everybody thinks about it. I put on here secrets to heart health. We're going to talk about 6 risk factors: tobacco abuse, blood pressure, cholesterol, blood sugar, your weight or body mass index, and your exercise. Secret number 1, if you smoke, quit. There's nothing more than you can do that improves your health than quit smoking. No matter what else you do, if you continue to smoke, it's like shooting yourself in the foot. You are going to, it's only a matter of time that you have some disease process from smoking. We're talking about coronary disease, but that's the biggest thing, you know, if you can stop smoking. And really tobacco of any kind, because you know, there's certain things, certain tobaccos might be better than cigarettes from a lung perspective, but from a heart, they all have nicotine and addictive properties to them, so they affect that. You know, smoking is not an easy thing to change. It's really different from different people. Some people put them down and never have another, and some other ones, it's a very hard time to quit. I had one patient come in and say, "I'm not smoking, but I could smoke one this long right now." So there's programs at King's Daughters to try to get over smoking, because it is the very most important thing that you can do. The next is blood pressure. 34% of Americans have high blood pressure, and what we consider high is 120 or over 80. Sometimes we treat with other things besides medicines when they're just first elevated, but we want the blood pressure 120 over 80. Now, if you have diabetes, kidney disease, you might want it even lower. Diastolic is 70. But hypertension or high blood pressure causes disease processes throughout the body. It not only causes things with the heart, with the brain and strokes. Anywhere there's a vessel, high blood pressure can affect it. So it can affect carotids, it can affect peripheral vascular disease, it can affect other organs. It can affect your kidneys. One of the biggest causes of kidney problems, besides diabetes, is hypertension. Out of control hypertension. And then it can even lead to blindness. Did I skip one? How do I go back? Where's my guy?
Where's the park man?
Oh, cholesterol. That bad word. That's why you had a healthy heart lunch. I think it's healthy. I haven't eaten it yet, but it looks healthy. Cholesterol. We like your total cholesterol less than 200. LDL less than 70, HDL 50. Now, these numbers are if you've had an event. If you haven't had an event or don't have diabetes, then an LDL closer to 100 sometimes is acceptable. When I say event, I mean a heart attack, a stent, bypass, any of those things. If you have diabetes, which we're going to get to, we view you as already having coronary disease as far as a risk factor, and we would treat you as if you already have it because it's such a strong risk factor for it. So cholesterol, you know, a lot of times you can do some of this with diet. To get this down to 70 and 50 that's on the screen, usually you need some help with one of the medicines. Now, you know, there's a lot of different medicines out there for that. Some people don't tolerate it, but there's different ways that we can do that, that not all of them are statins. We can do other things. The statins have a property in them themselves, not just lowering cholesterol, but it but it stabilizes plaque. And what I mean by that is, most people don't realize that when you have a heart attack, usually it's not that you have a blockage that went from 40 to 50 to 60 to 70 to 80 to 90 and 100. Over half of the heart attacks that happen come from a ruptured plaque, which means it might be 40 or 50%, but there's something in the plaque that becomes unstable and it ruptures inside and causes a heart attack. We know that cholesterol destabilizes the plaque and makes it more likely to do that. The statins not only lower cholesterol, but they stabilize that plaque. So what I'm saying is that someone that's on one of those drugs, even if their cholesterol is the same as someone else, they're going to have less of a risk of having a heart attack because of the properties of that drug. Diabetes, probably the number one. Smoking and diabetes are the two major risk factors, I think, that drive most of the degree of coronary disease in the country, and especially our area. And those are two that, you know, people always talk about genetics. That has something to do with it, but I have a lot of people that come and say, well, it all runs in my family. But when you look at their family, they all have diabetes and smoke. So is it really genetics, or is it what we're doing? There's no question that genetics has a thing in it. Because there's some people that do all the right things and things happen. So, but sugar, diabetes, is an essential thing to control, because diabetes affects every vascular bed in your body. It affects your brain, it affects carotids, it affects your heart, it affects peripheral vascular disease, it affects the kidneys, it affects everything. So the importance of that is that you want to prevent. And you know, when we talk about these things, we're trying to prevent something from happening. We have a lot of good things that can do to help you if things happen, but the best thing is to never have one. So if we can do things like lower cholesterol, quit smoking, get your blood sugar in the right range, that's going to really decrease your risk tremendously. And, you know, when patients come into my office and they smoke and have diabetes, I tell them that it is not a question as if you're going to have coronary disease. Only when. Only when are you going to have your event? Because when you add diabetes and smoking together, it's not like adding 1 and 1 is 2. It's like 1 and 1 is 5. Because both of those work on the inside of the blood vessel, and they work in the lining of the blood vessel, and they work on that causes a lot of things to happen. 80 to 120, 130 is where we want your blood sugar. Again, I have a lot of people that come in and go, well, 170 is pretty good for me. Not in the real world, it's not. Maybe in the world that or they come in and say, well, my blood pressure is high, but that's what I always run and that's good for me. No, it's not. It's what you think is good for you, but it's not good for you. And one of the greatest things about diabetes is it's, in a lot of people, preventable because of weight and exercise, lack of too much weight and not enough exercise. Because most people that have diabetes, now there's a type 1 that's juvenile diabetes, and has nothing to do with lifestyle. But when people have diabetes later on in life, it's type 2, and it's usually associated with being overweight or lack of activity. We always look at the A1C more than we look at blood sugar. Blood sugar is enough to check, but A1C is to let you know where you're. It's a glycosylated hemoglobin, and what it does is a red blood cell has a life of a few months. So once it is exposed to excess sugar, it is what we call glycosylated, which means it has some sugar attached to it, and we can measure that. You might really get strict control and not eat anything for 2 days and come in and your doctor checks your blood sugar and it looks good and you think you're getting a pat on the back until your hemoglobin A1C comes back to 6-7, which realizes that over the 90 days you weren't behaving yourself. So we got you figured out. BMI, body mass index. Now, we use that, weight is what we're talking about, but the body mass index is, and you can Google it, body mass index or anything, but it just takes into consideration height and weight. And they even have charts if you're not good at using a computer. But you put in your height and weight and it gives you your body mass index. So this tells you, when you look at a weight and somebody's 6'5" or somebody's 5 foot, their weight per se is not going to be the same, but a body mass index takes that in consideration. And we know that a body mass index greater than 25 it starts to put you at risk being overweight. A body mass index of 30 is what we consider obese, and 1 over 40 morbidly obese. Exercise, that dirty word. Through this, I went through rehab. The guy that I called him the killer. Corey. Stand up, Corey. I used to tell my family, I got to go see the killer. But you need about 30 minutes a day, 5 days a week. That would put you at where you need to be. Now, in good weather, not today, don't do this, because we don't want to use an AED on you. Walking around the park is a perfect thing it's a wonderful thing. It's flat mostly, and it's 1.25 miles, I think, around. But 30 minutes of walking. And, here's the thing about walking and running. Everybody says jogging and things. As far as cardiovascular health, you will brisk walking or walking at a speed is just as good as jogging. And you don't have as much damage on your body, especially when you get older. And they had this thing that said that every hour you walk increases your life expectancy by 2 hours. So it's just kind of a list of those things that we just talked about. No smoking, blood pressure 120/80, total cholesterol less than 200. If you've had an event, your LDL or bad type of cholesterol less than 70, the HDL, which is the good type of cholesterol, at 50, blood sugar, losing weight, and exercise. Put this here because, if you ever not know what that is, some of them are free, but anybody can get one of these at King's Daughters to let you know what your numbers are, because it's not expensive, and, you can't be an ostrich that you just say, well, if I don't know, it won't hurt me. That's just not true. Signs and symptoms of heart disease, just real briefly. By far the most common is chest pain in people that have coronary disease. And when you say heart disease, it has so much to it. It could be valvular, cardiomyopathy. I'm kind of looking more at coronary disease because in our area that is the most common. But chest pressure or just pain. Let me shout from the rooftops. Chest pressure is the same thing as chest pain. I don't know how many times that I talk to people and I say, have you had any chest pain? And they say no. After further questioning, they have what they call chest pressure, but it's not pain. That's the same thing to your doctor. Chest pain that mainly is exertional is your heart until it's proven otherwise. Meaning, I'm sitting here, I'm fine. When I do something physical, I get this pressure in my chest, an uneasy feeling in my chest, and when I sit down, it goes away. That's your heart, 95% of the time. Chest pain, chest pressure in the heart that radiates to the arms, associated sometimes with sweating, nausea, those times. But if it has an exertional component, it really tells you that you're probably dealing with coronary artery disease. Shortness of breath is also a big one. Some people don't exercise that much and don't get around as much, so they're not really getting that up to a level where they'd have chest pain. So to have chest pain at rest from coronary artery disease, you have to have a pretty high ischemic burden, which means you have to have a lot of blockage to cause that at rest. But shortness of breath or not feeling good can be a lot of different things, but it can be lung, like it was with me. But shortness of breath, not being able to do what you used to. And I always tell people to look at not what you did 10 years ago. No one can do that. But you look at your life, what you did last year. Can you see a difference? Can you see, I just can't do what I did last year because I'm short of breath. I don't feel as well about those. It's probably a very good idea to get those checked. A physical exam is a very important thing to go see a doctor, because he can hear things like murmurs and other decreased pulses and other things in one area of the body that should cause them to look for other things in the body. You know, because if you have carotid disease, you have a much more likely to have heart disease. If you have peripheral vascular disease in your legs, that's not an isolated thing. You're more likely to have it in your heart. You have 3 major vascular beds in your body: the head and neck, your chest, and your legs. And the same process that occurs that causes blockage in one will cause it in the other. Now, it's not to say we have a lot of people that have it in all of them. We have some that just have it in one and not the other. But it's the process that we have to look at. But the main thing that I tell people is, are they having symptoms that causes them not to be able to do what they used to, like in the year? Difference between men and women. I like to tell my female patients that women just do not play by the rules. And they don't. A lot of them haven't read, their symptoms haven't read the major textbooks of the classic. You know, if you read the classic books on chest pain, it is an elephant sitting on my chest. And if you're a man, you're much more likely to have that. Women, not so much. And that's why coronary artery disease is missed so many times in women. One of the other reasons is, especially in married people, when a man starts complaining of stuff, his wife usually makes him go to the doctor, and men don't make their wives go to the doctor. I don't know why that is, but I guess they're just, I don't know why that is. I better not get into some gender study up here so I might get in trouble. Got enough of that going on. But women some do have chest pain, but some have just shortness of breath. Some just have, I don't feel well. I've had women that come in and say, I just don't feel well. I can't do what I did, and they have 3-vessel coronary artery disease and have no chest pain. Nausea, shortness of breath, just not feeling well can be the only symptoms for women. And it's very important because with women after menopause, they don't, their risk of coronary artery disease comes down to what men are. And since their vessels are smaller in their heart because of weight of things, because the average woman is smaller than the average man, they don't do as well in some things of bypass and stents. So it's very important to get this early. You know, we have a saying in medicine, that in cardiac, that time is muscle. What I mean by that is you want to prevent things. When you're in the midst of having problems like this, you want to do things, whether that's a treatment or anything, before you have damage to your heart muscle. Because we can do a lot of things, but once certain things are damaged, sometimes they come back, but a lot of times they do not. Even though we've opened an artery and those types of things, the function of your heart might not come back in some people, and that goes on to other things. So women, be especially attuned to that. Look at your risk factors. You having any symptoms of that? I just don't feel good. Those types of things, see your doctor and get that checked. Assessment, you know, I don't want to go through everything that we do, but I think the first thing is you see your doctor, because a thorough physical exam and questions should put you on the right path. Now, there's some things that are confusing, and we have to do certain tests. An EKG, we do stress tests. If we hear murmurs and things, or want to look at the function of your heart, we do echoes. And then we do heart catheterizations on those that we have a high index of suspicion for coronary disease. And we have treatments, stents and bypass and those types of things. And people who have cardiomyopathies that don't have those things, or decreased ejection fractions, how well your heart, we have defibrillators and those things. But you have to come to get those things checked out. You know, 40% or so people present their first true big symptoms as a heart attack. And that's kind of scary, because a number of people on a heart attack, and it's higher than you really think, because people die at home on their first heart attack, don't live through it. So the key I want to leave you with is prevention. Questions? You can ask me anything. No questions. Yes.
What's your opinion of taking Zocor like when you're everything else is except your cholesterol?
Should you take Zocor for cholesterol if you don't have any other risk factors? Is that what you're saying? Well, cholesterol is a risk factor in of itself. And I think it depends on how high that is and what if you have a family risks and those types of things. A little bit, it's been shown the lower you have your cholesterol, the better long term. So, yes. This what?
104 is total cholesterol, but they still have cholesterol.
That's because when I talked to you about, it's been shown that after heart attacks that it stabilizes plaque, and what your husband most likely had was he had plaque, but not a high grade one that ruptured for some reason. Zocor and those medicines stabilize plaque, and it decreases, not just Zocor, I'm just saying because she said that, or one of them said, but any of the statins stabilize plaque, and it's been shown to decrease the chance of you having another one.
I've always had good blood pressure on the bottom, but not top.
Well, that's a good question. Our question is there a difference between top and bottom on blood pressure? The top is your systolic, which is the pressure when your heart is pumping. The bottom number is when your heart is resting. And it used to be that we thought, well, it was just the diastolic, that when your heart's resting, that's elevated as a problem. Now we know that that's not true, and that they both are independent risk factors for those things. So even though your bottom is normal, you need to treat the top number. And in fact, the older you get, there is it tends to be more like that, just the top number and not the bottom.
So if you have your regular heartbeat, what does that?
Well, I didn't really go into that, but irregular heartbeat, that's a broad term. That's like me saying, I have a car. And I say, well, what type? It could be a Volkswagen or Mercedes, or different things. An irregular heartbeat just means that when you're listening, the beats aren't regular. Now, that could be something as simple as a PVC or a PAC, a premature contraction. What we worry about with that is, though, if you're in atrial fibrillation, which is a totally irregular rhythm, meaning it's not normal, normal, abnormal, normal. It is just totally irregular. And the reason it's important to know that is because you need to be most likely on blood thinners or other things, because atrial fibrillation has a high risk of stroke associated with it if you're not on any of those medicines. Yes? What?
I want you to know that I eat my soup with pork.
Well, that's good.
You should get that from my bag.
What she's saying is I love to tell jokes, and most of them are bad, corny ones, and she's referring to one of my corny jokes in the cath lab. All right, what's your question?
I was going to ask you a question about cholesterol when you were referencing, you know, that exercise helps, but what kind of foods do you recommend to stay away from or taking to help with that cholesterol?
You know, there's so many diets, and people ask that, what about this diet, what about that? You know, there's certain things that work for you, but I think that the American Heart Association of a low-fat diet is still the best, because it's one that you can do the rest of your life. Too many fad diets, you lose some weight on them for a month, 2 months. You know, people say, well, I cut out bread. Well, you're going to be able to cut out bread for the rest of your life, because you have to look at this as a marathon and not a sprint. So a low-fat diet that's not high in red meat, and when I say low-fat, I mean you're getting rid of most of the things that we love, the fried foods. You know, you can take a carrot stick and fry it, and you might as well have eaten a French fry. Fried foods, red meats, the cream sauces and those types of things, and high sugary content things are the things you need to stay away from. Now, it's not to say you can't have certain things, but what is your diet all about, okay? You know. Yes?
How about salt in your diet?
Well, salt is not a risk factor for coronary artery disease, but salt is, in people who have congestive heart failure, it's a risk for retention of fluid. If you have high blood pressure already, salt can make that worse. So we tend to use the least amount of salt as you can get by with, because that is fluid retention, especially in people who have congestive heart failure or kidney disease, and it affects blood pressure. But it doesn't affect blockages. Yes?
I've been told that Crestor is one of the statins that will not reduce your good cholesterol along with the bad.
That will not reduce it? Crestor is one of the most powerful ones. It's about twice as powerful as Lipitor. And because of that, a lot of people, if you're going to have symptoms, will be most likely with Crestor. But it does lower, with the same milligram dosage, lower your LDL or bad type wear. There are some studies that have shown out in recent things that certain ones might lower your good as well. But the best thing to increase your good cholesterol is walking. There's no, I mean, we have niacin sometimes can, but most people can't tolerate it. But the one simple thing, we have a lot of drugs to lower your bad, but we don't have a lot of good drugs to increase your good. And we found now that they're both independent risk factors. But walking increases your good. Any other questions about anything?
Can you speak to vaping? I know you talked about tobacco, but vaping has become especially among our young people.
Well, I don't think we know much about vaping, and the more we know, we realize it's probably not good. I don't think there's been a comprehensive studies, but this idea that I will vape instead of smoke and I have no risk, that's a fallacy. We know that you still have nicotine in some of those, and we know some of the other chemicals. I think it's kind of out, but some of the early studies have shown that vaping has its own problems with it. So I would just say that, when it came out, it was like, oh, I can still do this and not have any risk factors, and that's not true.
Dr. Bush, how about weightlifting as far as
what?
As weightlifting? That kind of used to be reserved just for the males and the fat young males, but we see that coming along more and more, and then I've heard that it can be hard on your heart.
Well, I think in anything in moderation is not going to be hard on your heart. If you're getting in better physical shape and weights, and I'm not talking about power lifting, that you're doing those things and taking supplements. That's a whole different story, but most people aren't power lifters. So if you're in the gym, you're to tone up your body on a machine or little weights. That's a good thing. That's not going to hurt you at all. It's going to be good for you.
I've been doing this for years. I've wondered if it's hard for lungs or something, but I go kind of like, I guess, catching my breath. But
That could be a lot of things. Well, you can be just catching your breath. But I would say, has things changed in the past year? And a lot of times what's good is to ask people around you. Because, we're the best at denying things. Ask your significant other. Do you think when I see it both in the office, it's so funny because you'll have marital fights right there. Because one of them will just take the guy and say, no, I'm not that good. And the one, you can't do anything you did a year ago. Those types of things. So I think some of it's denial on what we do, but ask those around you because they can usually tell you, you don't look as good as you used to. You don't do what you know. I'm not talking about 10 years ago, but I'm talking about what you do in the year. Those people are the ones that are telling you those things. But non-specific symptoms like that can mean something or they cannot. So your doctor would be the best one to.
well, I have
Yeah. A lot of different things can cause that. It could be extra beats at your heart. Yes.
Do you recommend any over-the-counter supplements?
I don't recommend them. People bring in a lot and say, how about this, how about this? I think most of those are okay if they're FDA approved in the right amounts. They might not be, there's a lot of things you can take that I would say might not do you any good, but they're not going to do you any harm. So I think the things, Now fish oil is a little different. I think fish oil is definitely a good thing in a certain amount that can lower cholesterol. The cats hang around you after that, but now the fish oil now, that's another one of my bad jokes. Fish oil now, they have in capsules that don't smell like it used to. But that's a natural occurring thing. Any other questions? Okay, thank you very much. It's a pleasure to be here.